name is Bellew, and I've been a breast navigator for probably 17 years. I'm part of a care team, and so I gather information for that patient prior to her ever coming for her consultation. So I'm gathering her pathology, her imaging reports, any consultations that she may have had, and I'm reviewing that information and I'm making sure everything's in place. So that way when she gets here, we already know everything about her. Most of the time though, the patients will come in for their consultation and I'll bring them back. I will introduce myself, review their history in the room with them, and then I try to prepare them for their consultation with a physician. So I think it's really important for me to not just leave it at, okay, I've taken your history, now I'm going to walk out. I want them to know that when that physician comes in, what to expect. When that patient comes in, a lot of times it's like they're just hearing like blurs. So they're nervous, they're trying to ask the right questions. And then I've had the patients like, what did he say? What does that mean? So that's where my expertise comes in. So I'm able to sit down one-on-one with them and say, this is what that means. This is what type of cancer you have. And I think my most important role on that is they come in scared. And it's my goal to let them know that we've got a plan. You can be scared, but let go of it. We're going to take this a day at a time, and we're going to get you through this. And I'm going to be your friend for the next 3 to 5 years. So they can go home, they can call me, say like I didn't understand that, and I can simplify that for them. The seed localization, it has really been a godsend. Because before, when we would talk about needle localization for the patient, I would have to explain to them how they would have to have a wire placed the day of surgery and be protruding outside of their breast. So they would look at me in fear, because you're like, you've got a what? And so I would try to soften that up. So since the seed localizations come on board, it's a game changer. So now they can have that. They don't have to have it the day of surgery. They can have it done a month before. And so it kind of takes care of the anxiety level for the patient, because then they can take care of that. It's just like putting some type of clip in the breast. It's a pretty easy procedure, and then that part of it's done. So then the day of their surgery, all they have to do is show up. So they can focus on their surgery that day, focus on their family, but not focus on having a wire placed. So it has been a game changer.